Hello, I'm Dr. Dan Winter with the Center for Dental Sleep Medicine. I'm going to take just a minute to talk to you about the use of oral appliance therapy, or an oral mouthpiece, to treat obstructive sleep apnea. To understand how an oral appliance works, one must understand obstructive sleep apnea. Basically, simply stated, with obstructive sleep apnea, as the patient falls back asleep, the mandible and the airway will fall back, and it will actually close the airway. What we do with an oral appliance is hold the mandible in a downward forward position and thus, in theory, hold the airway open. It can be illustrated like this. If this is a patient, my right hand being the patient's mandible, as the patient falls asleep, the mandible or the lower jaw will fall backwards, and when it does, it closes the airway. The oral appliance, once placed and fitted, is worn by the patient all night long, and as the patient then closes their mouth or the mandible, it keeps the mandible or the lower jaw in a forward position. Now, this lower jaw can be moved forward by the patient, side to side, but the oral appliance prevents the mandible or the lower jaw from falling backwards, and thus holding the airway open. That's a simple explanation of how an oral appliance works. If you want to get more questions answered, go ahead and talk to your physician or their representative, and they can get you in touch with somebody who can help you.